So the Alexander study, the AUTO3 study, was a look at autologous CAR T cells, and so there's a great deal of interest in off-the-shelf CAR T cells. This particular CAR T cell product is a dual targeting CAR T cell, and so it's CD19 as well as CD22 directed. The CD19 contains an OX40 co-stimulatory domain, and the CD22 contains a 4-1BB co-stimulatory domain. And this was a look at treatment of patients with diffuse large B-cell lymphoma. The lymphodepleting chemotherapy regimen was the one that we're all familiar with fludarabine and cyclophosphamide. It did allow for bridging therapy if needed for patients. And this was an exploratory study in terms of dose level. And so the most recent data, at least from ASCO, looked at 3 different dose levels, starting at 50 times 10 to the 6th cells and escalating all the way up to 450 times 10 to the 6th. They also explored the addition of pembrolizumab to the CAR T cells in 2 different dosing regimens. One was to use a single dose of pembrolizumab on day -1, the day prior to the CAR T cell infusion, and then the other dose regimen was to use 3 doses of pembrolizumab given every 3 weeks, starting at day 14 after the CAR T cells were given. So the ASCO data looked at a total of 28 patients who were treated, and of course, as you might imagine, they were fairly heavily pre-treated, so anywhere from 2 prior lines of therapy all the way up to 10 prior lines of therapy, and most had refractory disease prior to treatment with these CAR T cells. Most of them were diffuse large B-cell lymphoma, not otherwise specified, although about a quarter of them had transformed disease, with originally presenting with follicular non-Hodgkin lymphoma. And I think the notable thing about this was the lack of cytokine release syndrome, which is generally a problematic complication for patients with receiving CAR T cell therapy. And so moving forward, the majority of these patients in this particular trial will be treated in the outpatient setting. And so it's nice to have an option for CAR T cells in the outpatient setting so as not to require a lengthy hospital stay. So I think there will be a lot of interest looking at this particular CAR T cell therapy in the future.